In this session, we are going to learn very briefly about fundamentals of national health programs. As of now, we have triple burden of health diseases in India. One is communicable diseases, the second is non-communicable diseases, and third is emerging diseases. Let us learn something about national health programs. When do you call a national health program? A program applicable to a problem of high magnitude, conceived and planned by Government of India to be implemented by the state governments across the state or in an identified problem area. What are the features of a national health program? As I told you, it is the genesis of a national program will be usually based on high magnitude of health problem due to either fertility, morbidity, mortality, challenged senility, deficiency, life cycle diseases, or high out-of-pocket expenditure. Nature, it may be communicable diseases, non-communicable diseases, or new emerging problem. What is the policy? It will be spelt under health policy or population policy or specific disease policy, like for example HIV/AIDS. Any national health program will have goals, objectives, strategies, targets and activities. These are national health programs. We have National Family Planning Program, National Malaria Control Program, National Malaria Education Program, National Tuberculosis Control Program, National Vector-Borne Disease Control Program, National Leprosy Eradication Program, National Program for Control of Blindness, Reproductive Child Health Program. We have National Iodine Deficiency Disorders Control Program, National Health Mission, NRHM, NUHM, National Cancer Control Program, Cancer, National HIV/AIDS Control Program, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, National Mental Health Program, National Program for Health Care of the Elderly, National Program for Control of Deafness. What are the priority problems in India? We have non-health problems, which is called as burgeoning population. We have high population growth. We have health problems, pulmonary tuberculosis, vector-borne diseases, malaria, filaria, Kala-Azar, Japanese encephalitis, dengue fever, high levels of mortality and morbidity of children and mothers, HIV or AIDS, endemicity of leprosy, high levels of non-communicable diseases, micronutrient deficiency, challenged population, aged population. Why there are still health problems in India? It is because of low literacy levels, inadequate environmental sanitation, poor nutritional status, poor maternal and child health services, poor personal hygiene, inadequate services for the poor, downtrodden, marginalized households, weaker health systems, poor governance, low levels of community participation, Panchayat Raj institutions. In this session, we have to understand certain terms: epidemiological triad, portal of entry, portal of exit, incubation period, reservoir of infection, source of infection, period of communicability, cases, contacts and carriers, iceberg phenomena. What should be known about the disease? First, we have to understand what is the global scenario. Then we have to understand what is the national problem, state level problem, local level situation. What is morbidity and mortality data, that is one. Then epidemiology, natural history of disease. What are its clinical features, diagnosis and treatment? How do you prevention and control? For example, pulmonary tuberculosis. We have to know disease burden, symptoms and signs of pulmonary tuberculosis, epidemiological features, case finding and indices, clinical profiles and treatment, prevention by BCG immunization, control, improvement in nutrition, personal hygiene, health education. And what are our national goals and targets under national health policy? In terms of prevention and control of HIV/AIDS, we will be knowing what is disease burden, what are its symptoms and signs of HIV/AIDS, what are epidemiological features, how do case finding and indices, what are its clinical profiles and treatment, what are the preventive measures, awareness creation and condom promotion, what are the control measures, improvement in nutrition, personal hygiene, BCC health promotion. What are the national goals and targets spelled out by MDGs, national health programs and sustainable development goals. In terms of prevention and control of vector-borne diseases, we have to note the disease burden. What are the symptoms and signs of malaria and what are the indices? What are the epidemiological features? Surveillance, active and passive surveillance, clinical profiles and treatment, preventive measures, physical, chemical, biological, anti-adult and anti-larval measures. What are the control measures? Mass blood surveys, surveillance, environmental sanitation and health education. National goals and targets under MDGs, national health programs, sustainable development goals. Prevention and control of leprosy, disease burden. We will be knowing symptoms and signs of leprosy and indices. Epidemiological features, survey, physical examination, skin test. Clinical profiles and treatment, multi-drug treatment, prevention and personal hygiene, avoidance of droplet infection. Control measures, surveillance, environmental hygiene, health education. National goals and targets under national health policy. EPI, UIP, CSNSM program and RCH programs. Expanded program immunization program 78. Universal immunization program between 85 and 91. CSSM program between 92 to 95. RCH program 97-2003. EPI, UIP and CSSM programs focused on newborn care, immunization of mothers and children, essential obstetric care, emergency obstetric care, whereas RCH is a decentralized, client-centered, demand-driven, quality-oriented life cycle approach program as per International Conference on Population Development held in Cairo in 1994. Major components of RCH program, there are few minor components too. What are the major components? One is child health, second is maternal health, third is fertility regulation, fourth one is RTI and STI control. Some indicators for comparison. We can use crude birth rate, crude death rate, infant couple protection rate, infant mortality rate, maternal mortality rate, child mortality rate, total fertility rate. Niti Aayog composite indicators, very recent one, 2017. National Health Mission. The NRHM seeks to provide effective health care to the entire rural population in the country with special focus on 18 states which have weak public health indicators. Because of inequality of distribution of health in the country and various challenges, the Union government on April 12, 2005 launched a National Rural Health Mission. It aims to undertake architectural correction of the health system to enable it to effectively handle increased allocations as promised under the National Common Minimum Program. National Health Mission, it has its key components: provision of health activity in each village. A village health plan prepared through a local team headed by the Panchayat representative. Strengthening of the rural hospital for effective curative care and made measurable through Indian public health standards and accountable to the community, and integration of vertical health and family welfare programs and funds for optimal utilization of funds and infrastructure and strengthening delivery of primary health care. It aims at effective integration of health concerns with determinants of health like sanitation and hygiene, nutrition, and safe drinking water through a district plan for health. These are the 5 main approaches in Health Mission. Communitization, improved management through capacity, flexible financing, innovation in human resource management, monitor process against standards. The NUHM would have a high focus on urban poor population living in declared and undeclared slums. All other vulnerable populations such as homeless, rag pickers, street children, construction works of high-rise buildings, flyovers and brick kilns and lime kiln workers, street side vendors, workers in unorganized sectors, commercial sex workers are all involved in Urban Health Mission. The NUHM therefore aims to address the health concerns of the urban poor through facilitating equitable access to health facilities by rationalizing and strengthening of the existing capacity of health delivery for improving the health status of the urban poor. The existing gaps in outreach and referral will be filled up through communitization efforts and link workers, urban social health activists who will be accredited. This will be done in a manner to ensure properly identified facilities are set up at each ward, district, which can be assessed as a matter of right. Reasons for increasing non-communicable diseases in the community, such as diabetes, cancer, stroke, and cardiovascular diseases. Change in the lifestyle, high saturated fatty diet, high level of sugar consumption, which is called a junk food, stress, alcohol consumption, tobacco chewing and smoking, lack of physical exercise, sedentary life, obesity, high salt consumption. Who will get diabetes? It is a type 2 diabetes which is recognized accidentally during some tests in the laboratory, loss of weight, too much hunger and thirst, frequent passing of urine or symptoms. Those who are of middle-aged, obese, stressful, holding higher positions, too much eating habits of sugar preparations, addicted to alcohol, lack of exercises will be the victims of this disease. Insulin not required in the beginning. One can manage the disease diabetes well with oral drugs for a number of years without any complications. Who will get cancer? Lung cancer, smoking bidis, non-filtered cigarettes, cervical cancer, multiparous women affected with human papilloma virus, oral cancer, tobacco chewing. Thank you.